Hi, this video is for PEH 170 First Aid. We will be covering the AED, which stands for Automated External Defibrillator. It is used on victims who we suspect are in cardiac arrest. The AED is a portable computerized device that identifies any type of abnormal heart rhythm. If the AED suspects that there is heart rhythm, it will tell the rescuer that shock is advised. If a shock is delivered to the victim, the goal is to stop that abnormal heart rhythm, whether it's ventricular fibrillation or pulseless ventricular tachycardia, also called VTAC. And the AED shocks the heart so that it could allow for a normal rhythm to return. So what is in an AED kit? Well, on the right is the AED machine. And then on the left at the top are two different packages of pads. On the far left would be the child pads, and then opened up would be the adult patches, followed by the cable connectors. A kit will also be supplied with gloves, scissors for cutting clothing, a razor to shave hairy chests on males, as well as a pocket mask, which is not present for this video. Other items might be in the kit, but for our purposes, this is the majority of those items. Now, as far as the AED goes, it's going to vary from company to company. Some AED kits, the moment you open it, it will power on immediately and the rescuer does not need to do anything. However, other manufacturers like this one, you would be required to power on that machine by pressing the green button. And so there are some other differences as well, but generally all AEDs are pretty much the same. Let's talk more about the different AED features. First, on your AED you will notice the number 1, and next to it is the green button. That is the power on button, and it is imperative that once you remove the AED from its package, you must set it on the floor or the ground next to the victim's head and shoulders and press that green button immediately. Continue to press it until you hear the activated voice. Number 3 at the bottom is going to be the shock button. When the AED tells you to shock, you will do so. However, not until you clear all of the people and yourself away from the victim. The other thing that I would like to show you are the adult pads. The adult pads, there will be 2 of them. The one on the left, that will be positioned directly under the collarbone of the right side of the victim. It does look like it's the left side of the body, however, it is the victim's right side. So that patch will go on a little bit of an angle directly underneath that collarbone. It actually almost touches the collarbone. The pad on the right, that is the pad that will go underneath the breast, a little bit on the side by the ribs. And as you can see, there is a diagonal type of pattern. And the reason why that is that is the type of electrical current that we want to help shock the heart. So on the back side of this pad is going to be a liner. You're going to end up pulling that off and attaching the pad to those specific locations. It is imperative that when learning how to do the AED machine, that the pads go exactly in the location that is shown on the picture. From there, after the pads have been properly attached, you would place this cord into the AED machine. And that is a little bit about the AED kit.